Hello, I'm Kerry Hull, America's Healthcare Advocate. We're talking about Medicare plans today. I'm here with Joyce Thompson, and we're going to talk about Medicare supplements now. So Joyce, what I always find interesting is people that want Medicare supplement plans want a different model than people that want Medicare Advantage plans. So what do you recommend on Medicare supplement plans? I understand the Medicare Part F, those are going away. What's new?
Correct. Plan F is going away in 2020. The Plan G is out there, and it's been there for a while, but now it's very affordable. Some companies have dropped the rate on their Part G, which makes it easy. Plan G does have a premium, but it has no copays. It does have a $185 deductible per year, but once that's met, everything is zero.
Here's something else that's interesting about the Medicare supplements. There is no network. So
Correct.
Any doctor or any hospital that accepts Medicare accepts Medicare supplements, yes?
That's correct.
One thing it's important to understand is there is no prescription drug benefit inside these plans. Unlike the Medicare Advantage plans where prescription drugs are rolled in, you have to buy a standalone Part D prescription drug. Is that correct?
That's correct. And there's many plans out there for the Part Ds and many companies, so that's not an issue. You can pay as low as $17.50 to as high as $58 a month.
Okay, so Joyce, the Medicare Part D, what's the amount of money that's allocated by the federal government? They're all the same.
They're all the
because
same.
It's factored in by the federal government. How much does each person get under Part D for prescription drugs?
They would get $3,850 per year.
Okay.
Per person.
That's not $3,850 of copays. That's $3,850 for the price of the medication.
And that's retail price.
Thank you. Okay. People always get this confused. That doesn't give you $3,850 of $20 copays. It gives you $3,850 to buy your medications with paid for by the government.
Correct.
So what happens when they get to the famous donut hole?
Then they have to reach $5,100.
Out-of-pocket
expense.
And then after you meet the $5,100, what happens?
Then you go back into where you get 90%
of the medication's cost is covered at that
Yes.
point. So that's what's important to understand about the Part D
Correct.
prescription drug coverage. So the takeaway is, if you buy a Medicare supplement, you're going to have to buy a Part D prescription drug coverage. If you don't do that and you wait, you get to pay
the penalty.
Thank you.
For life.
For life. So it's important to understand why, if you buy the Med Sup, you need to have that Part D prescription drug coverage as a standalone plan to cover your medications at $3,850 a year. That's the current benefit that's available. Thank you, Joyce. That was very informative. And you can find us where, Joyce?
AmericasHealthcareAdvocate.com.
There you go. And social media, America's Healthcare Advocate as well. We're up there on Facebook, YouTube, and on Instagram.